Wash your hands with soap and water for at least 20 seconds prior to the test. Find an area with good lighting and a clean, stable surface such as a table. Check the kit is not past the expiry date, which can be found on the box. Open the box without breaking it, as it will later be used as a stand for the extraction tube. Take out everything from inside the box. Check you have all the kit components and that their packaging has not been opened. There should be a folded instruction manual, an individually packaged sterile swab, a sample extraction tube with extraction solution with a foil covering, and a test cartridge that is inside a pouch. Take the extraction tube and push it into the green pre-cut hole marked on the box, all while making sure that it is stable. Now gently peel off the foil covering of the tube. Remove the swab from its packaging. Be careful not to touch the swab tip with your hands. Now we are ready to take the swab sample. If your nose is blocked, blow it before swabbing, as the snot may be too thick to use. Gently insert the swab 2 to 3 cm into the left nostril until you feel resistance. Slowly rotate the swab at least 5 times for about 15 seconds. Gently remove the swab from the left nostril. Now insert it directly into the right nostril. Again, rotate the swab at least 5 times for 15 seconds. Put the swab into the extraction tube so that the tip is fully soaked in the liquid. Twirl the swab tip against the sides of the tube vigorously at least 10 times. Break the swab at the crevice and drop the tip into the solution. Place the nozzle cap onto the extraction tube and squeeze the swab head 5 times, allowing the tip to be submerged under the extraction solution. Finally, place the tube back onto the hole in the box. Take the test cartridge out of its pouch and place it flat on the table. The cartridge should only be taken out of the pouch right before you are about to test and should not be used if it has been out of the pouch for more than an hour. Hold the extraction tube above the sample well. This is the round well with the letter S next to it. Squeeze the tube gently so that 2 drops fall into the well. Set a timer for 10 minutes. Read the results after 10 to 15 minutes. Do not read results after 20 minutes, as they may be inaccurate. If colored lines appear at both the test line denoted by T and control line denoted by Z, then the result is positive for COVID-19. Look carefully, as a faint line at the T line is still considered positive. If your test result is positive, follow the guidance from your local state or territory health department for guidance on confirmation testing if necessary, and if unwell, seek medical assistance. If only one colored line appears at the C line, then the result is negative for COVID-19. If your result is negative but you still think you may have COVID-19, for example, you have symptoms, repeat testing is recommended between 24 to 48 hours after your first test. If there is no colored line at the control line C, the result is invalid, and the test should be repeated with extra care taken to follow the instructions. Please read the instruction manual for further information on limitations of the test, and check the latest guidelines from your local health authority on what to do with your result. After the test, carefully wrap all kit components and make sure you dispose of it appropriately via general waste.